I walked away from a profession that I loved, that I jumped out of bed in the morning to get to, because I wasn't prepared for what was to come.
For sure he needs more rasps on that side.
It's kind of an up-down. She's got that left is more.
As someone who has struggled with mental health for most of their life, I was a zombie and I just didn't care about anything anymore, and that was really hard to walk into work and not be excited about seeing my patients. My name is Dana Gigliello Vega.
I'm Dr. Erin Holder.
Jackie Boggs.
Katie Garrett.
Dr. Lynn Kreiner.
I'm a licensed clinical social worker.
I'm an equine technical service veterinarian at Zoetis.
Ambulatory equine veterinarian.
I'm the current president of the American Association of Equine Practitioners.
A veterinarian and owner of Starwood Equine.
Veterinary social worker at Tufts University.
And practiced veterinary medicine for 18 years before I crashed and burned, and have taken the last few years off to heal.
The reality is that 1 in 5 equine veterinarians will leave practice within the first 5 years post-graduation. We have a problem.
All I've ever wanted to do is be a veterinarian, and while I don't regret that one bit, there are some challenges. We face long hours of work. We have to face life and death decisions. We walk next to you when you're making those hard choices, and those are things that we internalize. Veterinary medicine is facing a shortage in the number of veterinarians that we have graduating and are available to take care of your pets.
When I graduated, I had a job about an hour away from my future hospital, and 2 years out of vet school, I opened the doors of my veterinary hospital. While I was in veterinary school, they do an incredible job preparing you for being a veterinarian.
One of the challenges with veterinary school education is the tremendous amount that students need to learn in 4 years, and unfortunately, business education can be hard to come by.
They get into this career path because they love animals and they want to help them, and soon realize they also need to manage people and inventory and clients.
I got 2 hours of business training while I was in vet school, but zero training on how to talk to clients, how not to absorb the emotions that clients lie at your feet. Not having that information, not being prepared for it, did leave me feeling like, I got this. This is gonna, like, what could possibly go wrong? And so when I did hit the bumps in the road, I just wasn't equipped. I wasn't prepared for it.
Every veterinarian that I know got into this profession because they love animals and they want to keep them healthy and living their very best lives. No one wants to see an animal suffer.
There's a lot of people that want to be veterinarians. It's not all puppies and kittens and grooming the horses and, pony rides.
In actuality, their days are really up and down with different traumas.
A large majority of people don't understand what a day in the life of being a veterinarian is. And for me, it's going into a room where I'm, helping an elderly patient performing acupuncture, going into the next room and potentially dealing with a catastrophic event of euthanasia, wiping away that emotion, and then going in to see a new puppy or a new bird that comes into the clinic. This constant transition creates enormous fatigue.
All throughout the day, your emotions are moving back and forth.
You go to sleep at night and that's all you think about. You think about how you failed your patient because you didn't feel like you cared about them enough. You fail your family and everyone around you because you don't care enough.
We lose that ability to feel compassion, to feel the empathy for our patients and our clients.
Suicide is very prevalent in our community, but we know that it doesn't start there. It starts with other things like anxiety and depression, compassion fatigue, burnout, and oftentimes people forget to take care of themselves because they're giving so much at their job.
Mental health is so important because when we show up unable to focus or stressed out because of outside factors, we cannot provide our clients and our patients with the best of us.
One of the ways that we take care of veterinarians is to make sure that we take care of the entire veterinary team.
Dr. Zaytunian does a lot to support us in us supporting her.
We have team meetings on a regular basis, and you can often pick up when somebody's energy level or excitement level is off.
I can always schedule like a check-in, be like, I need an extra check-in this month and I just need to talk to you. And she's always more than happy to work that into our schedule.
My hope and what I'm seeing more of is practices really trying to focus on building that community within the team. And I only think that that's going to do wonders for the mental health of the veterinary community at large.
Often we continue to push ourselves so much and white knuckle that it's not until we're at our breaking point when we stop and realize that we need to get help. When I woke up one day and decided that I was going to walk away from everything, I did just that. Within 9 months, I'd sold my business, and instead of asking for help, I simply ran away. I was relieved. All I could think of was, please get me to the point where I can shut the door on my veterinary hospital that I built from the ground up and walk away from it. I was relieved. And then you feel guilty because you love your clients, you love your patients, you love your staff. Walking away from my veterinary hospital wasn't an instant distress. I didn't go from massive anxiety to none. In fact, the opposite. It ramped it up and I struggled intensely. It actually took several years before I could feel a little bit more normal, and River was a huge part of that. At the time, I had no idea why I was almost called to do this. I bought this horse sight unseen and in 24 hours became a horse mom. I would go out every day. I couldn't ride. I didn't know how to ride a horse. And we learned to play soccer together. Spending time with River, it transformed my life. It brought down my anxiety levels, and he made me be okay with myself. He was just like, it's okay.
Well, there is an undeniable bond between the human and animals that veterinarians and their owners feel. There is something really special and magical about a horse.
You can't really pinpoint it. They've got the soft eye, they're friendly, they laugh. Horses will laugh at you. Mine will sometimes yell at me. They tell me when I'm late.
So I'm a veterinary social worker, and I have the amazing opportunity to work with students every day. We offer equine-assisted learning to our first and second year veterinary students. It's hands-on activities, all ground activities, no riding, with the herd of our teaching horses. Okay, and come back to center. And as you breathe in, notice any areas of your body that are still holding some tension, and then bring that air up into your chest.
There's an old adage in the horse world. The best thing for the inside of a man or woman is the outside of a horse.
Just tend to grow that way.
Yeah.
So that's such a fun way.
My life is radically different now than it was 3 years ago. Every day is better, every day is beautiful, and I'm going to return to the veterinary profession. But right now, my mission is to bring together our community and to find a way to help as many people as I possibly can.
The American Association of Equine Practitioners is the largest organization that equine veterinarians belong to, and we are incredibly lucky that this organization focuses on the health and welfare and the well-being of veterinarians. As part of that mission, Zoetis recognizes the importance of taking care of the health and welfare of our veterinarians so they can take care of the health and welfare of animals.
The veterinarian community really are the heroes in this work and for these programs, and we need to do all we can to support them and being the best they can be as well. There's so many resources that can help veterinarians, their support staff and teams, and one of those solutions is these programs incorporating horses. Even for veterinarians who are around animals all day, every day, there's something special about being able to look at ourselves in the presence of a horse that gives us feedback that feels non-judgmental. It's honest and authentic. It's almost like the horses help us get in touch with our authentic selves.
AEP has created tools and resources to help veterinarians with their own personal health and well-being, as well as the health of their practice.
One of the things that the AEP has really focused on is making sure that these tools can be used by anybody and that they are customizable. So you can take them out of the box, evaluate them, and then tweak them to see what works for you individually.
NAMVI really focuses in 3 areas to combat the stigma in veterinary medicine as well as the mental health challenges. We really focus on resources, education, and support. Over the last decade, we've seen the conversation open up.
What we really want is for our students to start developing some of these crucial skills that will help sustain them long term. And we want that to happen while they're in training, while they're in school. So the earlier we start, the better.
Horses for Mental Health has partnered with Zoetis Equine to work together to amplify awareness of the impact horses have for mental health and in mental health services. And it's through their help that we're able to expand access to these services to the general public, to the veterinarian community, and they help us take care of our horses who do so much to take care of us.
Being a veterinarian is what you do. It's not who you are. And you need to take care of you so you can take care of your clients.
If you are struggling, even just a little tiny bit, you are not alone.
You are not alone.
You are not alone.
Please know that you are not alone.
You are not alone. And there is a community out there who wants to help you. And there are tools that you can use to help heal yourself.
Zoetis is committed to being always by the side of the veterinarian by supporting organizations that are actively engaged in finding solutions to these problems, such as Horses for Mental Health, the American Association of Equine Practitioners, and Not One More Vet.
I really encourage you to reach out and get help in whatever way feels comfortable to you. You are definitely not alone. Lots of people have been there, and I can promise you, it gets better.